Hi, I'm Michaela, and today I'm here to tell you about cytopathology. Now, cytopathology is a diagnostic technique that involves taking samples of cells from different tissues on different body sites and examining them for diseases, looking for signs of disease, and then trying to determine the nature or cause of that disease. Cytopathology is typically going to be used in finding cancerous or precancerous cells. So basically, if you're a cytopathologist, you're kind of like a cell detective.
Mm-hmm.
Now, you may be wondering where a cytopathologist works. Typically, they will work in a lab setting, examining cells for signs of disease and trying to determine the nature or cause of that disease. Typically, they will work in hospitals, private medical labs, university research centers, government facilities, or even in an industry setting. Cytopathologists may work independently when evaluating cells that seem to be normal, exhibiting no sign of disease, but they can also work side by side with a pathologist when examining cells that seem to be diseased and trying to determine the nature or cause of the disease. Now, maybe after hearing all that, you want to be a cytopathologist. And just like in any other career choice, there are certain skills and personality traits that would make you better suited to be a cytopathologist. In the case of cytopathology, those traits include being someone who's interested in sciences, especially being someone who's interested in medical sciences. If you're going to be a cytopathologist, you're going to want to be someone who's comfortable with working with modern technology, complex technology, and also complex instruments. You also are going to want to be someone who's comfortable working in a team. Because, as you probably know, the body is a whole lot more than just a cell. And when you're a cytopathologist, all you're doing is examining just the cells, and that's it. So, you're going to want to be someone who feels comfortable and is ready to work in a team. And most importantly, if you're a cytopathologist, you need to be someone who's detailed oriented. You want to be able to see all the smaller little details that make up the bigger picture. Not only seeing the bigger picture, but what the bigger picture is made out of. And also, it would really help if you're going to be a cytopathologist that you're someone who is able to produce accurate work even when under lots and lots of pressure and stress. You're also going to want to be someone who is ready to follow protocol and ready to follow certain procedures accurately to come up with the best work that's possible. So now, let's say you want to be a cytopathologist and you're wondering, what kind of schooling would I need to do that? Well, you're going to need a bachelor's degree, so that's going to be 4 years of college, and then you need to take 1 to 2 years of an accredited cytopathology class. And then after that, you're probably going to be an intern for a while. So, in total, that's maybe going to be 6 to 7 years, 7 years of education. So, let's say that after hearing all about what cytopathology is, where you might work as a cytopathologist, and also what personality traits and schooling you would need to be a cytopathologist. And even after learning about all that extensive education you need to be a cytopathologist, you still want to be one. And you start to wonder to yourself, well, how much money am I going to make? What kind of cash compensation am I going to get for doing all of that education and all of that homework? Well, the lowest your average cytopathologist is going to make is going to be $60,280, and the highest is going to be $86,012. But in between those two numbers, you have your average annual wage range. and that is going to be $66,365 up to $79,834. So, whether you're working as a cytopathologist in some sort of a hospital, private medical lab, university research center, or industry setting, or even as a teacher, educating other future cytopathologists, you can expect to make pretty good money. And now, lastly, I'd like to share some pretty interesting facts about cytopathology and cytopathologists. So, and one thing that's important to know, it's not really a fun fact, it's kind of a unfortunate fact, is that if you're going to be a cytopathologist, you're going to be sitting a lot, most of the time. So you probably want to get a nice, comfy chair for yourself. Another thing about cytopathology is, since the invention of this pap test, in the 1930s, the rate of death for cervical cancer has actually gone down 70% because the test is quick, easy, and relatively non-invasive, so you can catch the cancer pretty quick, treat it even quicker. And then I'd like to tell you about the other test that I didn't tell you about in this video, another test that cytopathologists use. That's going to be your fine needle ablation test, and that is going to be using a fine, thin needle which is inserted just below the patient's skin, and that's going to gather a wide range of cells which are then brought back to the lab and tested. This test is pretty good. The benefits of this test is that it's minimal discomfort for the patient, relatively non-invasive, and it gives you a good range of cells to test. On the downside, this test can have a pretty high risk because what can happen is called needle tract metastasis, which is where you're putting the needle into an area that's cancerous, and whenever you pull that needle out, that cancer will spread up into the needle tract, and that can be high risk because it's spreading cancer. Now, a lot of the times this is still used despite that high risk because it gives valuable information that the doctor is going to need. And those are my fun facts about cytopathology. That's it.